2014, 3 cases. 2015, 1 case. 2016, 2 cases. 2017, 7 cases. 2018, 42 cases. And in the last 6 months alone, nearly 60 cases. The cases I'm referring to are people who have been infected with hepatitis A in the Middlesex and London regions. I imagine that for many of you, when I say hepatitis A, your mind may quickly go to television ads warning you about ice cubes or fresh vegetables from some hotspot vacation. And certainly prior to 2018, most of those people would have contracted this viral liver infection overseas, either while on vacation or visiting family and friends. But in 2018, that wasn't the case. The number of infections rose dramatically, and the people who contracted the illness did so right here at home. And this spike of disease did not affect all people equally, far from it, in fact. Most of these cases were amongst those who were homeless, who were underhoused, or who used illicit drugs. Why did this happen? What was it that led to an outbreak of an otherwise distant disease amongst this group of people in our community? As we reflect on health and wellness this evening, I want us to reflect on the health of communities, on our community. And I want us to ponder if we can truly be healthy when there are those in our community who suffer. And I want us to consider that our health issues may truly be issues of justice. Good evening, and thank you to Samir for the warm welcome. My name is Alex, and I'm your representative civil servant tonight. I'm also a doctor, and I work just down the street at the Middlesex-London Health Unit, this region's local public health unit, and together with over 300 committed people, we work to promote and to protect the health of our community. We are the organized efforts of society, in other words, the civil servants who focus on the health of the entire population. Our work often happens in places you might not expect. It often happens outside of clinic and hospital walls. It happens in restaurants, in schools, in pools, in shelters, in homes. Our work happens in council chambers and committee meetings. As a public health physician, unlike most other doctors, when I talk about health, my stories are very rarely about patients or individuals. They are, at their core, about communities. The most commonly quoted definition of health was developed in 1948 by the World Health Organization, and it speaks to a state of complete physical, mental, and social well-being, and not merely the absence of disease. It's a good definition. But to me, it should be expanded to capture the idea that health is not simply an individual experience or a reality, but a collective one. Health does not simply serve the one, but it is a resource to many. And the health of one of us in a community is linked to the health of all others in a community. And my story about hepatitis A is one of those community stories. The hepatitis A virus is transmitted in chaotic environments where there is often limited access to sanitary conditions, an unfortunate reality of life for those who are homeless, underhoused, or who use illicit drugs. As a result, they bore the brunt of this outbreak, and sadly, it is this community that bears the brunt of nearly every outbreak. In the past 5 years, amongst people living in these conditions, the Middlesex-London region has experienced disturbing outbreaks of invasive group A streptococcal disease, a potentially deadly bacterial infection, HIV, opioid poisonings, and even more recently, tuberculosis of all things has yet again reared its head. And these are simply the acute diseases. The story is no less concerning when we consider chronic diseases. In the London metropolitan area, the most financially impoverished amongst us have nearly 5 times the rate of hospitalizations for chronic obstructive pulmonary disease than the most well-off. Similarly, that group has higher rates of anxiety disorders, substance-related disorders, and diabetes. This is why, as a public health doctor, as a community-focused guy, I find myself thinking more and more about justice. We sometimes see justice as simply compensation for a wrong, but that's not the justice that I'm talking about. The justice I'm thinking about is the fair and defensible distribution of privileges, reward, and opportunity in our society. And quite simply, I believe that behind almost all of our health problems, there is a justice problem. These differences in health are not simply the predictable outcome of poor genes and bad choices. These differences cannot be written off as individual failures or bad luck or divine providence. Health is more than knowing what you ought to eat, but also being able to afford it and being able to access it and being empowered to share it. Wellness is more than just having an optimistic outlook on life. It's being surrounded by a community that embraces who you are, differences in all, that represents you, and affirms your existence as a beautiful and a vibrant and a valued human being. These differences are inequities. And we see them amongst those who are the most marginalized because there are structures in our society that have created an unequal distribution of money and of power and resources, particularly amongst people classified by things like race, class, gender, or sexuality. In public health, and as a society, we can only address these inequities if we are able to identify, support, and engage with the oppressed and the marginalized, those communities that are living in the absence of justice. And we can only see justice as a health problem if we understand that health is a community issue. My dad and my mom grew up in Barrie, Ontario. As was the fate of all youngest in a Barrie family, my dad was a goalie and grew up playing hockey throughout Simcoe County. Many of his stories have remarkable parallels with my own from growing up in rinks, but there is one that is so notably different. He tells this story of standing at one end of the rink, minding his net prior to puck drop, and gazing down the ice towards his opponent. But rather than being able to trace the space from the ice to the rafters, a cloud of cigarette smoke and Zamboni exhaust would gently hang and obstruct his view. We have come a very long way when it comes to commercial tobacco. And the tide changed for that battle when we realized that smoking did not simply affect those who smoked, but also those around them. It was when we realized that commercial tobacco was a community problem and not an individual vice. I have another story for you. Earlier this decade, a disturbing trend began to emerge here in this city, here in this province, and across this country. An increasing number of people were dying from opioid poisonings. The initial reaction was mixed here in London. Some in the community called for a supervised consumption facility where the principles of harm reduction could be made a reality, and those living with addiction could safely inject or consume and be connected with supports in a non-judgmental space. The response to this suggestion was lukewarm at best. An informal survey of readers of the London Free Press in 2013 found that over 50% opposed a safe consumption facility, and some local politicians predicted at the time that public opposition would be, quote, biblical. And yet, this past fall, this city's temporary overdose prevention site was recognized with a Pillar Community Collaboration Award. Permanent sites will shortly be in place. Since it opened its doors in February 2018, just over 1 year ago, there have been nearly 14,000 visits to the site and 83 reversed overdoses. And while there is so much more work to do, there have been quarter by quarter declines in the past year in the number of deaths from opioids in this city. What changed? What allowed for such a profound shift in our willingness to embrace such a life-saving and yet challenging intervention? I think that we stopped looking at addiction as a personal failure, but as the manifestation of a community struggle. We saw the injustice of the situation, We remembered the humanity of those who suffer in ways that we may not understand, and we realized yet again that an individual's health and well-being is never and never will be independent of the world around them. And that is my call of action to you tonight. See health and wellness as a community issue. Imagine the potential for everyone to be healthy and well. Reject the self-help book. When we see the health of others as integral to our own, we are able to act in remarkable ways. We are able to say no to commercial tobacco smoke in public spaces. We are able to say yes to harm reduction and to safe consumption. By changing our perspective, we can see the link from justice to health, and we can be empowered to make some changes. And by doing so, we can help everyone in our community to be safer and healthier. Thank you.